Hey everyone, this is Troy with the Advanced Spine Joint and Wellness Center. Hey, welcome back to our Thursday afternoon podcast. Hey, if you're looking for us and you want information, maybe you've heard some information from us before or seen some of our podcasts, you can find us online. You can simply search ohiopain.com, so easy way to find us there. You can find us on Facebook by searching at Advanced Medina. And then on Instagram, you can go to advanced_spine. And then, of course, a great source of information where we have not only this podcast, but many of our informational videos are up on our YouTube channel. So a big suggestion would be to go and subscribe and to the YouTube channel just by simply going to YouTube, search for Advanced Spine Joint Wellness, subscribe, follow, and you'll get a ton of information there. We've had some guest surgeons on recently. And we had a big topic a few weeks ago in a request to discuss this further, which was when we were talking about SI joints for the potential source of back pain. And the SI joint studies tell us 25 to 40% of the time are the potential source of back pain. So that being said then, what are other potential sources that might not only just contribute to back pain, but also to sciatica? So we had a lot of requests based on that topic, and it really took off. So today we're going to talk a little bit about Piriformis Syndrome and its potential implication in sciatica, how it oftentimes goes underdiagnosed or misdiagnosed, and then how do you diagnose it? And then, of course, most importantly, what do we do about it then? So if it is Piriformis Syndrome, well, what are we going to do for this? So without further ado, let's get into discussion today. So first, let's just identify the term sciatica. Sciatica, being a difficult term, is basically describing a symptom. And the symptom is pain that is typically radiating. And it can radiate from kind of the mid-back or lower back area, or what a lot of people will describe their hip when they point in this area. And it's typically radiating into the glute. So pain that just goes from the lower back radiates into the muscles in the rear end, the glute, or into the hamstring, or all the way down the leg. And sciatica can be described in many different ways: sharp, stabbing, shooting, etc. And sometimes associated with numbness, tingling. And then the thing that we worry about is if there's associated weakness, which means that we're damaging the nerve pretty considerably. So that's kind of the definition of sciatica. And as we talked about in some of our previous videos, if you've seen those, is that sciatica has a handful of different potential sources mechanically where the nerve is just getting pinched. That can be in the spine, and we've talked about these topics before: spinal stenosis, disc herniations, disc bulges, disc protrusions, etc. It can be from the SI joint, as we talked about on that previous video, big source of discomfort. Then comes the piriformis muscle, which we're going to discuss on this model. And then, of course, the hip joint, if there's arthritis in it. We're going to talk about that one next week as our potential source of sciatica. So let's talk about the piriformis muscle. What is this thing? What's going on? So if we look at this anatomical model, if we had an MRI vision and we could look into me right now, this is what the spine would look like. And if we pull it out and have a good look here, we have a handful of bones here, and then our discs, which are just spacers and shock absorbers for these bones. And those things keep these tunnels open for the nerves. Then we have 3 nerves which make up the sciatic nerve. Number 5 here, number 4, and number 3. And these 3 nerves join together, make one common conduit, and they're one big nerve, and they travel right in front of the SI joint, which we talked about last week, and then down through the pelvis. And then what's going to happen, most importantly, they're going to come down through the pelvis and make a 90-degree turn, and it's going to come out here, the backside. And what's waiting for it is the hip and the piriformis muscle. So basically, to keep it simple, piriformis muscle is a small muscle where it's basically got a little window for the sciatic nerve. And in school, they explain the piriformis as the window of the sciatic nerve, because as it comes out through the pelvis, there's a little split in that muscle, and it's going to then travel through. And what happens is then, if that muscle tightens up and we get a tight piriformis, think about that nerve going through, and then we have a tight piriformis, it pinches the nerve, and that then can cause your sciatic symptoms. Now, the difficulty becomes, how do you diagnose this? How do you treat it? What do we do for it? Oftentimes we see patients. So the number one thing that we treat here at our practice, we are a busy practice. We see 500-600 people a week. Now, with that being said, the majority of the patients that we treat have sciatica. So to say that we're good at sciatica, I think would be an understatement. We're really, really good at treating sciatica. But the first thing I always tell patients, and our staff will always tell patients when we meet you, is we first need to establish the diagnosis. Where is it coming from? And most doctors get tunnel vision. We all just go, hey, let's get an x-ray, let's get an MRI scan. We look right at the spine. But we really fail to address the other sources. So imaging for Piriformis Syndrome, quite frankly, is only partially helpful. So when we get images, x-rays, MRI scans, a lot of chiropractors, we have chiropractors here, a lot of orthopedic surgeons, even myself, I made this mistake early in my career. We would treat the images, but we failed to treat you as the patient by listening well to where your symptoms come from, doing a very detailed physical exam, and really trying to identify the source. And when we identify the source, that allows us to better treat it. But unfortunately, most of us simply treat the images. We find an image, perhaps we see some disc bulging, we see some disc herniations, maybe some spinal stenosis, disc degeneration, and we label that as the source. And oftentimes we're right, but oftentimes we're wrong. And we begin treating that issue, and this is where we meet most of you out there listening to this going, good Lord, I've seen physical therapists, I've seen chiropractors, I've seen other doctors, and I'm getting shots in my spine, I'm getting epidural steroid injections, I've had RFAs, I've had surgery, I've been fused, I've seen a handful of chiropractors, and I'm just not getting better. And you've got this pain here on the backside, and it's shooting down your leg, and you go, why won't this get better? Well, quite frankly, oftentimes, in what we see, it's because we're treating the wrong problem. We haven't found the source, and probably just treating some images. But we really aren't getting down to the nuts and bolts of what is going on with the piriformis. Now, that being said, as we evaluate this potential issue, the number one thing to do is a really, really detailed exam. And there are exam findings that can help us determine, is this Piriformis Syndrome? Is this a bad hip, like arthritis? Is this an SI joint issue, like we talked about last week? Or is this a spine problem? Our exam, in conjunction with what you tell us, your history, and then in conjunction with some smart imaging, we can establish our diagnosis. And we need that first. I just happened to see a young lady today. It really, really bugged me. She's got pain going down her left arm. She's got pain going down her left leg. This has now been going on for years. She's seen rheumatologists, neurologists, multiple chiropractors, physical therapists. She had seen a pain management physician, and I said, okay, that's not great. I'm sorry to hear that. So all of these things you've been through and it hasn't worked. What's the diagnosis? And she kind of looked at me, and I said, well, what did they say was wrong? And she didn't know. Nobody told her what the problem was. And I don't even know if they've established it, quite frankly. I was really frustrated. So the first thing we have to do is establish the diagnosis. What is this, and where is it coming from? When it's Piriformis Syndrome, this is not a complicated issue to treat. But we see this post-surgical. We see a lot of folks who've had surgery, perhaps they've failed, or maybe you've had fusion, you go, hey, some of my symptoms are better, but I'm still having some residual symptoms, and everybody's looking at the image on the spine saying, hey, everything looks okay with the fusion, but you're still having some symptoms. Oftentimes this can be our source. So, things to consider with Piriformis Syndrome. Imagine the spine, in particular, through these four structures that we've identified. The spine, the SI joint, these muscles running through here, there's glutes and the piriformis and many others, and the hip are like gears in a watch. Now, oftentimes what happens is when one gear in a watch becomes dysfunctional, guess what's going to happen to the other gears? We're going to see some dysfunction. So there's usually something that's causing the piriformis to be dysfunctional and tight. It doesn't just tighten up on its own, something's causing that. Oftentimes what we see with the piriformis is if you look at this spine, I've got it looking right at you, one of the common things we see is that the pelvis is unlevel. And if the pelvis is unlevel, if we look at it from the back, what we're going to do is we're going to create some muscular imbalance. So the pelvis can be unlevel side to side. And can that cause some imbalance in the piriformis? You betcha. So the pelvis tipping is kind of setting off some gears to start beginning to work dysfunctionally. The muscles here in the glutes and the piriformis, absolutely. Another big one is the SI joint, and another big one is the spine. So we're going to start to see some dysfunction in these areas, and oftentimes the piriformis then becomes under considerable stress because the pelvis is unlevel, and it tightens up, and then before you know it, it gets tighter, tighter, tighter until it pinches the nerve, and now we have symptoms. So looking at the pelvis is a really key thing to do. A good physical examination occurs when we look well through the piriformis with these guys, our hands. And we can palpate through the piriformis, compare to side. And when you're used to feeling these, you can tell whether they're under tightness, if there's tension, if there's taut bands in it. And by feeling this along with passive motion, meaning me moving and working through your hip and the SI joints, we can start to isolate where is this? And oftentimes it's the piriformis. Big issue. Now another thing to look at with the pelvis as a potential source as well is we have to look at balance. Balance is critical. Balance meaning that there are muscles up in the front and there's muscles in the back of our legs and lower trunk, meaning the hamstrings in the glutes, and then the quads up front. And what happens is some of the muscles that turn in from our legs, our quads turn into hip flexors, and those hip flexors, some of them, the iliacus and the iliopsoas, they attach to the front of the spine and the pelvis. But if they're tight, they can begin pulling, creating a pelvic tilt. As you can see, I'm tipping the pelvis, I'm accentuating that so you can see it. And if we have these tight muscles, that most certainly, when we start to create imbalance this way, is going to create some imbalances in the back. And likewise then, our hamstrings attach back here. And if we have tight hamstrings, that can create some pelvic tilt in the opposite direction, which puts some imbalance through the SI joints and the piriformis as well. So one of the keys is to look at the pelvis from side to side and then front to back. What is going on? And evaluating those muscles. So we need to look and see what's going on with your quads. Has anybody looked at them? Has anybody compared that then to the hamstrings to see if we have balance? Runners tend to be quad dominant. We see that a lot in runners, and that causes a lot of issues then in the backside. We start to see piriformis and other simple issues, IT band issues, because they become so quad dominant. And so many people are just built that way. Sometimes that's just the way God builds us. Some people just have tight hamstrings or tight quads. But if there's imbalances in other places, that sometimes can be the source of what's causing some problems through the pelvis that begin causing the piriformis to tighten up. So again, it's gears. If we have tight quads, that becomes the first gear out of problem. Then it tips the pelvis. Second gear into the piriformis. Third gear, now we have a pinched nerve. And all of a sudden, we're all just trying to treat the symptom and just treat the symptom. We aren't really looking for why did this happen in the first place. So those are the key things on examination that we need to find that help us start to learn what is going on to cause this. Why is this happening in someone perhaps that's young? I just saw a fella, he's an umpire, had a normal MRI scan, and he's constantly leaning to his right all day long. This guy umped 66 games in 2 months. And of course that he's leaning to his right constantly. Now, of course that created some imbalance and then ultimately led to some radiating nerve symptoms. It's created an imbalance in his body with that high level of umpiring. So these things have to be looked at along with images. Now, images can be a couple different things that can be helpful. First and foremost, a lot of patients downplay the importance of an x-ray, but an x-ray done well and explained well can be a great tool. We love weight-bearing x-rays. Weight-bearing x-rays are a very important tool to start learning about things. Weight-bearing x-rays, in particular from the front, help us learn where's your pelvis. So when you stand up and the rubber hits the road, now what happens to your pelvis side to side? And then also from the side, weight-bearing, where are you at in these potential pelvic tilts? Where is that? So we can see that on a weight-bearing x-ray. And then doing weight-bearing x-rays with movement, there are some things that hide behind the scenes that if we don't do weight-bearing x-rays with movement, sometimes we miss them. And that's little problems called a spondylolisthesis or a retrolisthesis. Now, oftentimes they show up on traditional images, but we can find out if they're unstable with these flexion extension views. And the other thing that a weight-bearing x-ray does from the side is tells us How much space do we have in these discs, and are they smaller or are they full? The fuller they are, the healthier they are. The thinner they are, the more they degenerate, the more they can potentially pinch nerves too. So we have a lot that we can gather from a weight-bearing x-ray. MRI scans are great too, because that does tell us more about the discs, and it looks at the nerves in detail as well as the spinal cord. So we can see if there's disc bulges, herniations, etc. But we have to put that together with your history, location of pain, severity of your pain, where does it go, what has it responded to, what has it not responded to, a physical exam, and then the images. And oftentimes we can then diagnose, is this Piriformis Syndrome? And if it is, then we've got to get down to the nuts and bolts and begin to treat it. Now, in treating Piriformis Syndrome, the first question to ask is, why is it there? And if there's imbalances through the pelvis, we need to start getting the pelvis back to level in any way that created the imbalance in the first place. So we need to look at the quads, look at the hamstrings, look at the pelvis. Where's the imbalance? And we need to start addressing them. If it's tight quads, we got to loosen those up. Perhaps get you in with a massage therapist, a physical therapist. If the piriformis is tight and that's pinching the nerve, we got to get through there and loosen up those muscles. Sometimes what are called trigger point injections can be done. Sometimes massage therapists can get there and loosen up, physical therapists. And then if there's any imbalances through the pelvis, oftentimes we have chiropractors on staff, they can start to retrain the pelvis back to normal. But the key becomes treat the problem where it is, piriformis, and treat why the problem came there in the first place. And oftentimes we see resolution of the symptoms. So if you find that you're dealing with pain in the rear end, truly just pain in the rear end, pain in the backside, pain in what you would describe as your hip or your glute, it's radiating into just the glute, down the leg, all the way down the leg, into the hamstring, and it's bugging you, and you've seen some people, and oftentimes this is the common one. Hey, I've been seeing a chiropractor for 6 months and I'm just not getting better. Hey, I've seen a physical therapist and a chiropractor and I'm just not getting better. I had one young lady who'd been seeing a chiropractor for a year and a half, kind of mad. She wasn't feeling any better. And I get chiropractors want to try to keep things in good shape, but her symptom wasn't improved that she went in for. So if that's you out there, you've seen a pain management doc, hey, you're getting some shots in your back, you've had surgery and you're struggling, we'd love to take a look at you, see what we can do to help. Easiest way to find us online, you can just simply search ohiopain.com. The number that's up on this video, 330-242-7669, that is our scheduling number. Julia standing by 24/7. You can text, you can call, kid's always available, she's amazing. We're in network with all major carriers. First step is for us to just get a good look at you, find out and establish where is this coming from. Hey, great chatting with you. Next week what we're going to do is we're going to be talking about hip arthritis. This is another potential source of sciatica that goes overlooked. We look forward to it. Have a happy and safe 4th of July, and we'll talk to you next week.